So, talking about the success rates being proven in your study, in your clinical study, what was the criteria for a treatment to be called successful?
In the data that I have compiled, that data is based on these inventories that are completed by the patient before and after treatment. That is the patient's criteria of success. My professional aim, defining 100% success, would be complete remission of the problem, which very commonly happens.
Very commonly?
Yes, and yet the patient sometimes are satisfied with less than 100%, and they go away and I don't see them anymore. But nevertheless, these rates, I have done other reviews, in particular of cognitive behavioral therapy, which is the standard of care in my country. Comparing the success rates of that method to the success rates of subliminal therapy they're so far apart, it's hard to compare them. And cognitive behavioral work, average overall, I would estimate probably 42% by their own studies. Whereas if I eliminate weight from the numbers and those that few areas of problems that are very complex, if I cut those off, now my success rate is up around 85-90%. Twice as effective as cognitive behavioral therapy in just a first glance. On the website of this nonprofit institute that I created years ago, the Subliminal Therapy Institute Incorporated, on that website there is all of this data presented. Whatever detail you want, it's there, including statistical computation and most popular statistical term is Cohen's D. So all of that data is presented there for the different disorders. If some researcher wants to dig deeply, the background information is there also.
And I know you are a practically orientated person, and you are a scientist. And you've done one clinical study, and as far as I know, you have begun to do another study. Can you tell us about this study?
Yeah, I have engaged a small, very tightly controlled study in the treatment of this subliminal therapy method in chronic pain. It's a two-group study, 30 subjects, treatment, no treatment by subliminal therapy, both maintaining continual medical supervision. It's maybe, I don't know, 10%. It's really just beginning. But it is a formally institutional review board approved formal study.
And it's a controlled study that really prove the effect of a method. So doing this study and the study being done in Mexico will prove very valid.
Yes, within the professional community, whether it's accurate or not, the criteria that gets attention is a controlled, randomized study, and nothing else is considered. Mm-hmm. My biased view, I think that's very restrictive and unnecessary. I think there can be very legitimate results without randomization. If treatment of a given problem, with patients, say, who have a history of migraine headaches and 50 successful eliminations of the migraine headaches, that should get attention without any statistical randomization.
Yes, I agree.
But nevertheless, that's why I am doing this controlled study.